I've been talking to Dr. Bilski about something kind of neat you're doing now, and I think it's going to solve a lot of problems, maybe yours too. Maybe there's something you have wrong with your mouth, or there's something, your teeth you're concerned about, but, you can be kind of concerned and embarrassed even to go into a dentist in the first place. You've got something now that is really an immediate, something folks could do right now.
Yeah.
Tell them about it. It's very neat.
Yeah, it's, in our terms, it's called Smile Virtual. Basically, it is a way that you as the patient can send a picture of your face smiling and then a close-up picture of your smile. And there's a little spot on this landing page. It's a template where you insert your 2 pictures. Could be 3 pictures. And if there's a question, what would you like to change most about your smile? And then, or comment more. And, we don't need a manifesto, but we just want a general real quick, like, what don't you like?
Yeah.
And you had an earlier question about that, like, what can we put on this consult? So as an example, say you catch me on Instagram, or you're on our website, you're looking for something else, and you see this free smile consult. And then you click the button, it sends you to a landing page, and it'll explain what you need to do. So you take your face picture with a smile and then a close-up smile. Insert it in the boxes. What do you want to change most about your teeth or your smile? And then it could be, I'm missing this front tooth, or I'm missing this back tooth. Okay.
Pretty simple, take a couple minutes,
exactly.
Take a shot, and then what happens? They hit send?
Then it gets sent. I receive it in my office. And then I set time during the day where I review all the consults that are coming in from this free consultation for smiles. And I do a quick 2-3 minute, I see your pictures, I understand your problem, why don't you come in for a no obligation, free consultation, so I can get a better idea diagnostically, because the actual smile consult is a starting point. You get to meet me virtually. It'll be a recorded presentation I'll send back to you about what you are requesting to be looked at.
So you've taken a look at their, you might get obviously you can't make a decision by the picture, but you might have a clue.
Correct. Like, say, example, you're missing your 2 front teeth, and you've been wearing what's called a flipper, and you're done with it. You don't want to wear it anymore. And you're thinking about implants. You take the picture of your smile without the teeth in, and then a close-up smile. And then I'd say, Randy, you're missing your 2 front teeth. I see what you're talking about. To me right now, I think the best thing for you is to come in and have a consultation regarding dental implants and some of the other things that I'm noticing right now. That appointment would be about 30 minutes, and there's no obligation. It's free. I need to take x-rays and some photographs.
Those x-rays and photographs would be free too?
That's complimentary.
No kidding. Wow.
Yeah. And we also talk a little bit about what I'm seeing in there, and I give you an idea of cost ranges. I don't go into detail about insurance. We have Danielle, who's our dental specialist in our practice, that takes care of most of it. The other girls up in the front area, Sophia and Lindsay, have a good idea about some things too. But when it comes down to doing some significant dentistry, we want to have a specialist with Danielle give you an idea.
Sure. Yeah.
But my point is, it's like, this is a way to get an opportunity to see me, hear me, give you some examples, identify a little bit of the problems, what the cost could potentially be, and then that would be up to you to feel comfortable enough, because it is scary to come into the dentist.
Sure.
If you haven't met me or seen me, like, you don't know how I may react.
Well, it's nice that I would have a sense of what it's going to cost, because then I know I want to do it. And then also, again, I'm not going and meeting you and then explaining the problem. You already kind of, know what's going on.
And even with that situation there, you're missing teeth, and then I give you the range fee for implants, and it's like, oh my goodness, that's a lot of money. Well, there's smile transition that we have. It's the old term was Snap-on Smile. That is for, well, so far everyone that's come in that couldn't move forward with the implant part of it, but would like to have a prettier smile in that situation, they've accepted the smile transition, which is it snaps on. It's not the old partial with the metal and the clips and that kind of stuff. It's tooth color. We can make it any tooth color.
Yeah.
It's in, out, clean it, put it back in, brush and floss your teeth like you normally do. So you get to a point where it fits your budget to move forward with the other stuff. Maybe it's a bridge. Maybe you have crowded, crooked teeth. Maybe you have spacing. It's an Invisalign type situation, clear aligners. Maybe you want veneers. Maybe you're just talking about a little crooked tooth that has a rough edge that's discolored. It might be a simple filling, or it might be whitening, or it might be just smile shaping. What if you have bad gums and that are bleeding all the time? You took a picture of that. Well, I could tell you about the lasers that we use. No cutting. It's a regenerative. That means we can get the bone and the gum to grow back, provided your bite is fine and you're doing the proper stuff. And then it gives you an idea. And then if it makes sense to you, then you call and you ask for Lindsay or Sophia to schedule an appointment for the no obligation free consultation.
Yeah.
But it kind of it doesn't waste your time,
Right.
because I give you a little bit of information, but I can't identify exactly until we get you in the office so we can properly diagnose and develop a solution. And then if you hear and you don't like anything that I have to say, or it doesn't fit your budget immediately, and you're not interested in something like a smile transition or whatever it is, I mean, there's a lot there. That's why I think it's imperative that we get that part in front of you first.
You get a lot of the uncomfortable stuff out of the way quickly doing this.
Exactly.
And that's what's really great about it. I mean,
Yeah. The three top things, and I'm not going to do them in order. Everyone knows the order they'll be in, is like, how long does it take? Does it hurt? And the third one is
Cost. How much is it going to cost?
And what's number one is cost. So
Sure, it is.
and I think we all know that, and particularly in these times of day, we know things are going up.
Yeah,
Gas
sure.
and eggs are always the top, the inflations. We want to make sure you know what you're getting yourself into. And we tell you, we explain it to you. If we have to wait, then we strongly recommend that you just maintain cleaning appointments, and we'd love to have you as a new patient.
You know, it's kind of funny because I know a lot of dentists talk about we're the dentist for scaredy cats or something. It's a very popular thing, but you kind of are, because there's more to be scared than just the pain. There's just everything that goes into it, and the finances and all. And I think you help take all that away.
So what we found is, if we can educate a little bit before we perform, patients understand that. I don't know. Is it buying a car? That's the comment we always get. Buying another car, doctor? I no, not. But I understand, and I have a pretty good sense of humor. We're really here just to help, but I'm not here to force you to do something, Randy. It would be, this is what I think.
Yeah.
But I need your thoughts.
Yeah.
Because if that doesn't fit your budget, or you feel that I haven't covered everything, you need to stop me and ask me specifically what's on your mind.
Yeah.
And then we can move forward. And a lot of times it is, hey, why don't we just wait? I don't see anything that we need to do that's emergency. I don't see anything that's even an urgency.
Yeah.
And why don't we get you back in for a cleaning, and then you can get comfortable with our practice, and then we go from there. Most of the time, most of the people, after we get done talking to them, we find our healthiest patients are the ones that at least consider our suggestions. And if we have to phase it, what are we doing in year 2024, year 2025?
Sure, you can do that too, right? I mean, plan.
The average person takes about 3 to 5 years to complete all of
Everything.
their dentistry, barring any mishaps and accidents.
Well, so you learned something right now. It's something that could take 3 to 5 years.
Yeah, so we're-
they're not going to come in and come out, and it's like, it just can't be. I mean,
it's I've done this a long time. It's a wonderful thing. I'm actually more conservative in the way of how we handle moving forward with treatment, because I'd really prefer that you committed to it and with an understanding.
yeah.
And we stand behind the things that we do and the things we don't do too.
That's very good. Bilski Dental. Check them out.